Every week, a group of Torrance Memorial physicians, oncologists, surgeons, radiologists, and other specialists gather to review cancer cases. Known as the Tumor Board, its goal is to offer a consensus on the best treatment for patients with cancer.
Well, what we try to do in the Tumor Board is have what we call a multidisciplinary approach. So we present different oncology cases or patients with different types of cancer, and we have multiple different specialties here.
Because in fact the Tumor Board is composed of multiple specialists, radiologists, pathologists, the surgeons and the plastic surgeons who will talk about the best way to possibly remove the tumor, and then the radiation therapists and oncologists. And so basically it is a multi-specialty group.
And it allows them to get together and review the radiographic films, pathology slides. A lot of times these doctors don't have the ability to actually see the pathology. They get our reports, but this allows them an opportunity to see the pathology and use that in conjunction with the radiology.
There was a brain MRI which was negative. So the PET scan shows very prominent.
We started this many, many years ago. It is now a requirement in terms of certification, but we have been doing it for many years before that.
What we try to do at the Tumor Board is basically look at a variety of cases, some of them relatively straightforward cases, just to make sure that we're all on the same page. The other type of case that we look at is more of these unusual cases where it's an atypical tumor type or a case where there may be 2 or 3 or more approaches to this. It's nice to have a panel come together and give their input from all of these different disciplines and try to come up with a consensus answer from everyone.
The Tumor Board is divided into 2 parts. The first part is strictly breast cancer. The second part is virtually any other type of tumor, and at the request of the patient's doctor will be put on the agenda to be discussed.
For the general Tumor Board, we don't at this point look at every case prospectively just because of the sheer volume. We see a lot of different cases, and what we've tried to do now is sort of make individual Tumor Boards on a weekly basis. So on the first and third Thursdays of the month, we look at thoracic or chest or lung cases. So we have a panel of lung surgeons and medical oncologists and radiation doctors and pulmonologists as well that look at these cases, and we all come to a consensus on the challenging cases. How do we manage this? How do we treat this particular patient? And we need to come to some consensus because there's no one right answer.
This gives the patient an opportunity to have the benefit of multiple physicians of many different specialties in the hospital who are thinking about only their case and will render an opinion about the best treatment to their doctors.
So by presenting cases here, you are getting a second or a third or a fourth opinion, if you will, and so that should give patients some peace of mind that their case has really been looked at by a lot of people.